For my third presentation today, I'm going to talk about the water pollution, which has been happening due to effect of war. And before that, I want to thank again UN Habitat for giving me this chance to explore about those problems in Sudan. With this study, as I mentioned earlier, considered as the first study about the war and the environmental impact of war in Sudan. And all information that I gather here coming from secondary data, coming from different sources, then coming from medical associations of Sudan, engineer association of Sudan, journalist, the body of Sudan, and NGOs, different NGOs working in Sudan right now, and some research coming from 4 universities in USA. Environmental impact for water quality, as everyone knows that water is the most important element for human being life. Without water, people cannot survive even and they cannot further enhance their life. The poor water quality in Sudan has serious implication of public health, and this war has created level of food insecurity due to the water. 26% has been minimally adequate and stable of food access due to the water. 37% has been stressed crisis, 27%, 10% is of highly needed, and this percentage, by the way, could be changed any moment due to the war movement and the intense of the war as well in Sudan. At least 8.2 million people out of Sudan right now, out of 49 million population, have been fled their homes since the fighting broke out, and all of this adds on to the problem of war. The exposed to contaminated water created a lot of problem to the people and has been led to a variety of diseases, including diarrhea, dysentery, typhoid, and also particularly harmful to children, elderly, and individuals with weakened immune system. War in Sudan has severely impacted the country's water quality, destruction of critical infrastructure, in Khartoum, in El Fashir, in Niala, and many parts of war in Sudan, which compromise to access to the clean water and put millions of people is the risk of clean water quality. The war as well has exacerbated water shortage with fighting between rival factions, leading to increased humanitarian needs. Displacement of over 2 million people has further strained water resources as overcrowded refugees camps and settlement struggle to provide adequate sanitation and clean water. Destruction of infrastructure that have been due for this war, damage to water treatment facilities and pipelines, reduce access to clean water, forcing people to rely on unsafe resources. Military activities, chemical spills, water waste dumping, contaminate water bodies with pollutant and toxin. Displacement of refugees, every part of the in Sudan now adds on to the problem of the water issues. Water in Sudan, as of already, we have shortage for since 2020. The water is not absolutely clean, and due to this war right now, a lot of issues has been accumulated to the problem of war in Sudan. Unsafe sources of Sudan. Without drinking water, people have resorted to using water from any part of Sudan, even from unsuitable resources. During the early months of the war, civilians reported waiting for days in their homes for violence to subside so they could collect enough water to last at least for a few days for their life. Some of them, they go to banks of Nile River in Khartoum. Some of them, they have to go to the hospital at night to collect the water because consider that hospital still they have some water. But right now it is outbreak and no one can control whatever it is. Nile River has been contributed to the problem. All the dead bodies which they thrown every part in the river, or the river has been completely unsafe. So a lot of problem coming out of the water. Sanitation system, there is no sanitation, there is no sanitary well known in Sudan, and this one adds onto the problem because people they use every part. So the White Nile state has risen from 15 meter cubic before the war up to 300 meter per day right now in Sudan. Sewer installation White Nile site has also been exceeded, developing a risk of transferring waterborne disease and already happened unfortunately in Sudan. Up to 2020, more than 10.5 million people in Sudan practice very poor defecation, meaning that they defected in bushes and other open areas. Then you can imagine now what's happening now in 2024 issues. Water system fighting has partially or totally destroyed several water treatment plants and affected water pumping stations. On April 15, 2023, one of the main water pumping stations in Bahri, Khartoum North, suffered from damage, resulting in frequent water uh, outrage in Umdurman, Umbadda, Bahri, Khartoum, Al-Fashir, Niyala, Al-Jazeera, Madani, Sinar, all of this area has been completely affected by the water body. So besides the damage to the water treatment plants and pumping stations, constant power outrage also adds onto the problem because there is no water to pump the water from the wells as well. On 6 August, Al-Fashir 2024, a water department, Al-Fashir department in North Darfur reported that its power service was interrupted as electricity workers were on strike after the RSF detained on its workers. And also this one adds onto the problem whereby the workers, they run for their life and therefore there is no people to run or operate those water bodies. Destruction of water infrastructure is well noticed because all the water treatment plants, pipelines, and wells has made it difficult to provide safe drinking water to many parts of the country due to there is no workers to run the system. Contamination of water resources, the dead body, dead animals, remaining of weapons, air pollution, carbon monoxide, carbon dioxide, um, or military activities. That one added to the contamination of water sources. Reduce access to the water as a result of no people to run the systems. People run for their lives. Therefore, there is no clean drinking water in many parts of Sudan. And as a result of all of that one is environmental degradation, destruction of forests, wetlands, which act as natural filters for water, has contributed to the degradation of water quality. And this has increased the risk of water pollution and sedimentation as well. Limited water treatment. The ongoing war has made it difficult to maintain and operate the water treatment facilities. This had led to decline in quality of treated water, which can increase the risk of a waterborne disease, as I explained at the beginning of the session, whereby that diarrhea, etc., typhoid now become popular in many parts of Sudan. Cholera as well is there in Sudan. Disease outbreak that we can notice it. It will notice in the many parts of Sudan, even the people whom they are remaining now in part of Sudan, such as measles, malaria, dengue, cholera, polio, typhoid, and acute water diarrhea may have a high risk of lethality for the children, for the infant, for the elderly, for the women, for the animals as well, for the um, uh, marine life. What are the immediate actions that is needed from the people of United Nations? That's number one. We need water quality testing. At least we have to test the water so as to understand the quality. And this one, NGO can help a lot in that. We need emergency water plan supply. That is, the Sudan has a lot of experts. They can help in this one, whereby they can provide emergency water supply to affected populations. But we need the help from United Nations as well. Wastewater treatment, that one's completely absent. So it's highly needed to prevent release of pollutants into river bodies. For the long term, infrastructure rehabilitation is highly needed and highly needed experts from all over the world. Water conservation, pollution prevention, that we need the expert from all over the world to help Sudanese community. Integrated water resources management, whereby adopt an integrated water resources management approach that considers the interconnection of water resources and the need for sustainable management. And this one will help to balance the competing demands for water and ensure its equitable distribution. Community-based water management is highly needed, and this one a lot of experts from the water, from all over the world regarding the water issues, can help Sudanese communities to tackle the problem of these issues right now. Environmental impact assessment is highly needed. International cooperation. We seek international cooperation and support for water resources management efforts. This may include financial assistance, technology transfer, and capacity building as well. What are the policy and institutional support that we need? We need Sudan as a home, which we said at the beginning, all starts as a home. We need Sudan as a home. We highly needed to water resources management law, foreign aid, regulatory framework, institution capacity, public awareness so as people of Sudan could live in peace. I hope this my message has been reached to all United UN Habitat all over the world, and hope this war could end up soon, so as allow the people of Sudan to build up their country once again. And once Sudan is built up, that means all the neighbors, all the other part of the world will be in peace as well. Thank you very well, and all the best. And once again, I want to thank Egypt for hosting this UN Habitat 2024. And I would like to as well to thank UN Habitat for giving me the chance to be to present about those environmental impacts, which consider as the fairest voice out of Sudan environmental effect world